Good morning, ladies, gentlemen, my fellow colleagues. My name is Suleiman Afisa Urahachi, 500 level pharmacy student AB Zaria chapter. I am making a presentation on aripiprazole, a drug of choice for treatment of psychotic disorders like schizophrenia. The main challenge of most antipsychotic drugs is their side effects, and aripiprazole is a model innovated to tackle these many side effects of other common antipsychotic drugs. I'll start by defining the word schizophrenia. The word schizophrenia is gotten from two Greek words, schizane meaning to split and phrene meaning mind. Putting the two together, we have split mind. Schizophrenia can also be defined as a condition where a patient has multiple personalities. Although these are not clinical or pharmaceutical definitions of schizophrenia, clinically, schizophrenia can be defined as a type of mental disorder characterized by abnormalities in thought, perception, extensive withdrawal from the outside world, and intensive focus on one's own mental life. Schizophrenic patients may present with positive and negative symptoms. If you've ever seen a person with schizophrenia, they experience things like hallucination, which can be defined as false perception. False perception is a false detection of things with the five senses. They will start smelling false things olfactory. They will start hearing false things, also known as auditory. They will start seeing false things visual. They will start feeling false things tactile, and they will start tasting false things gustatory. They also experience delusion. Delusion can be defined as false belief, which may present as paranoia and extreme distrust for others. They will start thinking a person is after their life when in the actual sense they are not. These are known as positive symptoms. Negative symptoms are affective flattening. Affective flattening is lack of ability to express emotions. Anhedonia, lack of ability to experience pleasure. Avolition, lack of interest. Asociality, lack of ability to socialize. And alogia, poverty of speech. There are several theories that back up the etiology of schizophrenia. We have the genetic theory. Genetic theory states that schizophrenia can be inherited. That is, it can be transferred from one generation to another. Dopamine theory. Dopamine theory occurs as a result of overactivity of dopamine in the brain. And overactivity of dopamine and underactivity of acetylcholine leads to psychotic disorders. Overactivity of acetylcholine and underactivity of dopamine lead to neurological disorders. Neurodevelopmental theory. Neurodevelopmental theory states that schizophrenia occurs as a result of an in utero disturbance. Psychosocial theory occurs as a result of social economical influence. It could be social due to drug abuse due to peer pressure, and it could be economical due to financial capabilities. Although money is not the only reason why people abuse drugs nowadays, even the less privileged are not exempted. The drugs that are used in treatment of psychotic disorder are classified into high potency antipsychotic, moderately potent antipsychotics, and low potent antipsychotics. First, what is potency of a drug? Potency can be defined as the amount of drug required to elicit a pharmacological action. The lower the amount of drug required to elicit a pharmacological action, the higher the potency of a drug. The high potency antipsychotic examples are haloperidol and flufenazine. Moderate potency antipsychotic examples are lozapine and perfenazine. And then the low potency antipsychotic examples are chlorpromazine and thioridazine. All these drugs act by antagonizing dopamine receptor in the mesolimbic and mesocortical pathway, leading to a reduction of dopamine level in the brain. There are many side effects that these drugs that act by dopamine blockade cause, some of which are sedation, anticholinergic, cardiovascular, sexual dysfunction, metabolic, seizures, extrapyramidal syndrome, and neuroleptic malignant syndrome. All these are these many side effects of all these antipsychotics that I have mentioned. Aripiprazole is a better drug of choice because it is a partial agonist. It doesn't completely block the dopamine receptor. It acts as a partial agonist, so it gives a somewhat balance of dopaminergic side effect and cholinergic side effect. Aripiprazole has lower tendency to cause extrapyramidal side effect. Aripiprazole significantly improve negative symptoms from week 1 to 6 and positive symptoms in 1 week. Aripiprazole has a long half-life, so it takes a longer time for it to be absorbed, for it to be distributed, assimilated, and excreted. So it allows for a single daily dose. Aripiprazole has brought about less instances of of metabolic disorders like hyperglycemia and dyslipidemia, and also less instances of weight gain and extrapyramidal syndromes. Examples of these extrapyramidal syndromes have been seen are akathisia, which is also known as restless leg syndrome, acute dystonia, sustained muscle contraction in the neck and the face, tardive dyskinesia, abnormal involuntary movement of the face, the head, and the neck. Aripiprazole has significantly improved quality of life. The starting dose of aripiprazole is 2 mg once daily or 5 mg once daily for 2 days. Maintenance dose is up to 10 mg once daily, and the maximum daily dose of aripiprazole is 30 mg per day. And note that aripiprazole is contraindicated or should be avoided in pregnant and breastfeeding mothers. In conclusion, aripiprazole has been medically approved by the US in 2002, and it has been tested to produce better efficacy, drastic improvement in positive and negative symptoms, lower tendency to cause extrapyramidal side effects, and improved psychosocial functioning. Thank you for listening.